Hello and welcome back to another episode of Seniors Physical Health.
I welcome Dr. Priya Gokhale, a practicing family physician in Mumbai. Dr. Gokhale aims to improve the holistic health of her patients, not just with medication, but also lifestyle modification. Doctor handles all age groups from pediatrics to geriatrics. So, welcome, doctor. आपका स्वागत है.
Thank you so much.
Welcome, doctor. Thank you so much for being with us today. I wanted to ask you a question. What are the illnesses which are diagnosed late in seniors because their symptoms are overlapping with other common symptoms?
Okay. Good morning, everybody. First of all, thank you so much for inviting me to this platform. The first most important advice that I would like to give all the senior citizens is, if you find any kind of symptoms that are lingering for a long time, or they are getting aggravated with time, and you feel that they're not getting better with the first line of treatment, do not shoot in the dark. Approach your physician and figure out what's wrong with you. Now, the disease plethora is really vast. So I would like to touch on to the most important 4 to 5 diseases where, yes, the diagnosis can get delayed. Secondly, the diagnosis should not get delayed. And thirdly, yes, they are dreaded diseases. Now, whenever I'm handling so many senior citizens, whenever they come to me, I find that they are mortally scared of the 2 big C's. That's cancer and that's cardiac disease. You know, they'll keep asking me, doctor, मुझे heart की बीमारी तो नहीं है ना? मुझे cancer तो नहीं है ना? I find them like mortally scared of these 2 things. Okay, so the first most important disease where the diagnosis can get delayed is cancer. The most notorious ones are pancreatic cancer, colonic cancer, prostatic cancer, where yes, the diagnosis can get delayed. What are the common symptoms where you feel, okay, this is a normal thing, it's not going to be cancer, but watch out for these symptoms. It can be just like a lingering cough. It can be just a mild, subtle lack of appetite, a subtle loss of weight, or it can be just your abdominal pain, burning, bloating, a little bit of difficulty in swallowing. It can be a constipation, diarrhea, or sometimes alternating bowel movements, or it can be somewhere like a little blood-stained stool where you can say, oh, it's just a pile or a fissure. And you can have suddenly, you know, like lumps somewhere appearing in the body, or like some skin changes, or generalized fatigue. So don't wait with this. Figure out whether you're not harboring some kind of sinister tumor somewhere. The second most important disease is your cardiac disease. Very often I get patients saying, you know, I have a chest pain here, or something like, मुझे घबराहट हो रही है. Now, friends, घबराहट is a very, very difficult word to treat in Hindi especially. It can be nothing, it can be so much. So what are your common symptoms that can mimic a cardiac disease? Is something as simple as a musculoskeletal pain. They'll say, मुझे यहाँ दर्द हो रहा है, मुझे इधर कुछ tightness लग रहा है. Or it can be like a tooth pain, a jaw pain. It can be one or both the shoulders. It can be a scapular pain in between. It can be in between your back. These are some vague but common symptoms that, you know, it may mimic cardiac disease. Or it can be a burning, belching, a feeling of acidity. So don't wait for this. Senior citizens, I generally immediately send them for a cardiogram, some cardiac enzymes, and I rule it out. So figure out whether you have an underlying angina or some kind of blocks. The third most important disease is pulmonary tuberculosis. I feel really sad to say that today, the world's capital for TB is India. We have a lot of schemes going on. The BMC, the government is really trying hard, but it is a challenge. So why, you know, what are the common symptoms where you know that it can be TB, it can't be TB, always that little confusion. It can be a simple lingering cough with or without sputum. It can be a little bit of a lack of appetite, again, loss of weight, a small evening rise of fever somewhere, or it can be just an abdominal colic, or it can be fatigue, tiredness. So rule out whether you're not harboring pulmonary tuberculosis. Not only the TB, but figure out that there are not some other lung diseases like bronchitis or bronchiectasis or some embolism or sometimes pulmonary fibrosis or some kind of a small tumor sitting somewhere in the lung tree. Not only TB in the lungs, but in India, TB is so high that figure out that it's not somewhere else in the body, right from the eye to the endometrium to sometimes an ankle joint, one of those. The next most important disease where your diagnosis can be delayed is diabetes and blood pressure. Now, today, the second highest populated diabetic country is India after China. But somehow we just feel the diagnosis is still undiagnosed, underdiagnosed. You know, so many times I get patients for fitness, maybe like a cataract surgery or some instrumentation. And when I see, wow, the sugars are so high, fasting high, BP high, I check the BP soaring high, and I find this resistance. You know, they say, doctor, मेरे खानदान में ना किसी को भी diabetes नहीं है, किसी को नहीं हुआ है, मुझे नहीं diabetes हो सकता है, मुझे नहीं है sugar. And then when I see the BP, doctor, I've always been normal. In fact, मेरा तो BP low रहता है. Well, then why is it so high just now? I can't give you a fitness. Well, your BP has not been checked. Maybe weeks or months or years. Why? Because maybe no symptoms, maybe mild symptoms, maybe a silent disease, or maybe sugars not been done, weeks, months, sometimes even years. And you know, the good part about diabetes, it's very easy to check. Just go and check your blood sugar. So don't wait for this. What will be your diabetic symptoms that are maybe appearing so common? Again, fatigue, less hunger, more hunger, or thirst, or just increased frequency of urine, or just kind of a tingling somewhere, loss of weight. So don't sit on this. All you need to go, just check your blood sugar. Even BP, I find there are so many silent walkarounds. That's why BP is known as the silent killer. Sometimes you don't get any symptoms. Minas, forget mild symptoms. You don't get symptoms. Mildness here and there, a breathlessness on climbing stairs. So just check it out. The next most important disease where diagnosis can get delayed, especially in the senior citizen age group, is your mind diseases and the progressive degenerative neurological diseases. Now, what exactly am I talking about? I'm talking about anxiety, depression, maybe an early onset dementia, or like a very first early stage of Parkinson's disease, or maybe sometimes motor neuron disease, or muscular diseases, or neuropathies, or like a multiple myeloma, any of those. Now, what do you feel? Like, you know, the children may feel, okay, dad has become old, or they'll say, you know, mommy is acting senile. So you know what, friends, don't do this. Figure out really, is it really only old age, or yes, there's something brewing inside. You may just find that your dad is like, you know, slowed down, or he's talking less, or some gumsum बैठे hai, kam khana kha rahe, ज़्यादा सो रहे, कम सो रहे, or you know, he's just finding it difficult to get up from a sitting area, or suddenly his walking ability has reduced. He's just shuffling on the gate. Or sometimes he may just talk less, or he may just shun his social interaction. मुझे नहीं किधर जाना है, मुझे अकेला छोड़ दो. Or sometimes, you know, they may just stop interacting with newer things. They may avoid functions. They may just have small spurts of memory loss, or they'll just talk a wee bit incoherent sometimes, and you're wondering, mom, what exactly are you saying? Maybe a quick acute memory loss, maybe a past memory loss, or you may just find that, you know, their muscles start getting a little wasted, or they just have frequent falls, or they're talking about some tingling numbness somewhere. So figure out that, is there a treatment for this? Can something be started early? Then I would just like to touch on diseases like your thyroid, liver, kidney, or osteoporosis, or certain autoimmune diseases, or some gut abnormalities like inflammatory bowel disease or irritable bowel syndrome, and so on. So this is how I would like to answer your first question. And one last thing about this question is, friends, why is there a delay? The whole medical fraternity is here. Our city is pounding with labs, centers. Why is there a delay? First reason, dar, okay? Fear, huge. That's your huge demon. All senior citizens are like, ऑल द टाइम मुझे कैंसर निकला तो मैं क्या करूंगा, मुझे डायलिसिस चालू हो गया तो मैं क्या करूंगा, मेरे लाइफ का क्या हो जाएगा, मैं जीऊंगा कि नहीं. So forget it, let's not check. First thing is fear. So what I try and do is just, reassure the patient that, we are there to figure it out. We are there to, everything has a treatment now. Medical system is so well advanced. Second thing, as Minas rightly put forward, is yes, the symptoms overlap common symptoms. Simple thoda headache ho raha hai, to kyun check karna hai BP? So don't neglect. Thirdly, friends, I have, interacted with so many senior citizens. It's a very sad thing, but I would like to point it out that very often there are logistic issues. Well, the old man doesn't have money in his pocket. I write a whole battery of investigations. Paisa kidhar hai? Kaise check karenge wo log? So first, is it pinching the pocket? Secondly, I find logistics. Go and do this test, go and do this scan. An old couple staying alone can't walk. Who's going to take them? So logistically. Thirdly, I find that in India, there is no social security system. And I find the children, many of them are not proactive. If I find the finances are with the kids and the old couple doesn't have a good bank balance, the children are not so proactive in checking it out, in figuring it out. What are these symptoms? Jaane to abhi, daddy abhi bhoode ho gaye, kitne saal jeena hai. So don't do this. If you have the means, be proactive, help your parents, don't sit back, or I find they're seriously lazy, or I find they're stingy. The younger generation, they do not help in figuring out what are these symptoms. Okay, I think Minas, that's about the first question.
All right. Doctor, I want to ask you one thing. Seniors को कौन सी imaging or blood tests कराना चाहिए, and how often? What is the gap between like a checkup?
Sure. See, if you ask me, there's a very thin line between over investigations and under investigations. Okay. Secondly, in our country, there are no strict protocols. So I find that neither the doctors are really sticking to some kind of stringent methodology or a stringent pattern. Really, there's nothing like that. We don't follow it so strictly. Neither do the patients. So I'll tell you honestly, I somehow make my own tailor-made list for all my patients. I look at the symptoms, I look at the age, I look at how serious is the issue, how impending is the investigation, how much is it going to pinch the pocket, and I try to miss not the important things. So that's how I plan for every patient. I know them for years. I figure out, are we missing some investigations? Is it imperative to do something? Then I get it done. Now, broadly telling you all about investigations and imagings, etc., I would first say that every senior citizen must do a comprehensive blood test at least twice in a year. What would this include? A basic CBC, both your sugars, renal profile, liver profile, kidney profile, thyroid, electrolytes, uric acid, creatinine, D3, B12, calcium, magnesium levels, in certain patients, tumor markers, and in all the males, a PSA level, that is your prostatic antigen level. Now, suppose I find a patient is diabetic or thyroid, or many senior citizens keep falling low on sodium or their creat is high, then I repeat those particular tests again and see to it that the levels fall in the normal range. The next imaging technique that I would like to tell all senior citizens is definitely go and do a basic sonography, abdomen and pelvis, at least once a year initially as a baseline. All the females must do a sonography, abdomen, pelvis by menopause. And I think all the males say by between 50, 55. It's one of the easiest technique, easily available and zero side effects. And it tells you so much. The next imaging or screening that is most important is cancer screening. When you talk about, first let's start with the breast area. All the senior citizens are all females between the ages of 45 and 55 are advised to do a mammogram at least once a year. And then after that, maybe once in 2 years or maybe once in 3 years. Mammogram still remains the gold standard for screening breast tissue. Now, sometimes if we find some suspicious lesion, then the doctor may advise you to do a 3D mammogram or maybe an MRI. Friends, sometimes all this is not available. You can't afford it. It's somewhere far. There's nobody to take you. Just use the palm of your hand. Why not do a simple technique? Once in 2 months, when you're having a shower, just check your breast tissue on your own and figure out whether you're not finding something lumpy or some skin changes. Then don't wait. Approach your physician and do your mammogram and see whether there's nothing wrong in it. The next one is the cervical cancer screening. All females are advised to do the cervical screening between the ages of 25 and 65. What we advise is a human papilloma virus cytology at the cervix once in 5 years. If all this is not available where you stay or some logistic issues, then at least a pap smear once in 3 years. Okay, or if you've had some kind of abnormal cytology when you were young or in your past readings, then maybe you're advised to do it more often or more frequently or even longer than 65. Otherwise, below 25 and after 65, there is no need to do a pap smear. Also, let me remind you that even if you have taken a cervical cancer vaccine, there's no shortcut to cytology screening of the cervix. That's the most important. The next one for females is the endometrial cancer or ovarian areas. We advise that you at least do a sonography abdomen pelvis once post-menopausal. What are we looking at? We're looking at endometrial thickness or the lining or the structure, the walls. You can even see the ovaries at that time. And suppose the gynec finds something suspicious or the lining has gone thick, then you're advised to do a DNC or a biopsy. Also look for abnormal vaginal discharges or sometimes abnormal bleeding, spotting. That is something we should not neglect. What about the lung cancer screening? Senior citizens are not advised to keep doing x-rays. There's been a study that this doesn't help to prevent lung diseases like cancers. Okay, so what are your risk groups? We catch high risk patients. Who are those? Smokers, and smokers. That's the worst thing to do for your lung. So my high risk people are smokers and people who have quit smoking in the last 15 years and whose packet years are 20 or more. Now, what is cigarette packet years? That means the number of packets that you smoke in a day multiplied by the number of years. If this multiplication quotient is 20 or more, then yes, you have to be more vigilant. And we ask the patients to undergo something known as low dose CT scans and keep checking these patients that is something brewing inside your lung tree. What about the colonic cancers? A basic stool test twice a year and a sonography is what I would advise. We're looking out for some abnormalities in the stool like occult blood or red blood cells. If there's something suspicious, then the surgeon can do a per rectal or a digital examination. If there's something abnormal, something hard, something lumpy, then we advise a CT scan of the abdomen pelvis and probably a scopy and a biopsy. What about the prostatic cancers? Prostatic cancer, most important is your PSA level. It's a simple blood test and a sonography. However, there is a little controversy now about PSA levels, that is your prostatic specific antigen, because they go high even with simple prostatomegaly. So sometimes people just get unnecessarily worried that why is my PSA level going high? But then suppose it goes higher than normal or it's climbing higher and higher, then don't wait. Then you see a urologist. They may do again a per rectal examination, some nodule or some kind of hardness. Then we have to do a CT scan and go ahead and do a biopsy. Next group is the cardiology diseases. Okay, what is my baseline? Every senior citizen, I think, must do an ECG at least once or twice in a year. Secondly, a lipid profile, minimum twice in a year. And what you need to do is blood pressure check. I would say at least 3 to 4 times in a year. If you are an established cardiac case, then you must go to your cardiologist, visit at least twice a year. Suppose symptoms are coming on quite repeatedly, or suppose you have a very high family history, or been a smoker, been a diabetic, then your cardiologist may advise you to do some imaging techniques like a CT angiogram or an angiography or a 2D echo test. What about your kidney diseases? Simple tests, urine routine twice a year to look out for microalbuminuria. That means, are you passing proteins in urine? Are you passing blood in urine? And maybe a sonography to check of the texture, brightness of the kidney. If something goes wrong here, then you have to be vigilant, do some more tests like EGFR, visit your nephrologist. Thyroid also, friends, it's a very simple test. Just do your free T3, free T4, TSH twice a year. Suppose you find something abnormal growing here, like a nodule or a goiter, simply go and do a scan of the thyroid area. So we know whether there's no some worrisome goiter or it's just a normal goiter. Liver enzymes also for the liver, say twice a year, or sonography suffices even for a liver to get an idea basically whether your liver functioning is normal or no. The next important screening is for osteoporosis. For the males, we do a baseline bone mineralodensity or a DEXA scan by 70, and all the females by 65. I find somehow in India, we ask for this, I think, pretty early in life. We are not so fit as a race. We come with joint pains and weakness and either dukh raha hai, udhar thakan ho rahi hai. So I generally don't want to miss osteoporosis. Or we also do it earlier in cases of an early menopause, or generally frequent falls or frequent fractures, or patients who have had been on some immunotherapy or some kind of chemotherapy. In those patients, we advise it a little earlier. These are the main protocols that I would like to insist on. But Sonam and Minaz, one very important thing that is not generally listed in routine protocols, I'm going to tell you importantly now. Number one, eyes. Don't neglect your eyes. अभी ना मेरे डैडी ना टीवी नहीं देखते, अभी ना वो पेपर भी नहीं पढ़ते. Have you guys figured why is that? Because the poor man is finding it all hazy, is finding it blurred. ऐसा fold करके रख देते हैं paper. So don't wait for you to get like blind. Please go to your eye doctors, because we tend to neglect. Why? Because there's no impetus. जाके office में अभी काम नहीं करना है, सीखना नहीं है, nothing. There's no big impetus to be productive. But eye is very important, friends. So minimum once a year, twice a year, how your symptoms are. I'm not worried about the number. What I'm worried about is your retina, your eye pressure, your optic nerve, glaucoma. All this could be preventable. So do check your eyes. Secondly, very important, ears. Don't just go and just check yourself when probably you have wax or you're in like major pain. You know, figure out whether is your hearing optimal. You know, after some time you'll just find your dad doing, "Aap kya bol rahe ho? Mujhe sun nahi raha hai." Don't neglect that. और अभी ना मैं फोन पे बात नहीं करता हूँ, बराबर से सुनाई नहीं देता है. Or some kids, they say, "Doctor, I just have to yell and talk to my mom. So, you know, she's just been more quiet." So don't do this. Find out whether it's a simple thing like impacted wax, or yes, there is something where I can give this particular person a small hearing aid and life will improve so much. So don't neglect these special senses. Special senses, I pay a lot of importance. Okay, the last but not the least, you may find this stupid and funny. For me, it's super important, guys. Teeth. We generally, even me, I wait to go to the dentist only when I have pain. But don't do that. See, today, there are so many great advances in dentistry. No dentist will want to just knock off your teeth. It's preservation and preservation. So even if you have to knock out your teeth, look out for dentures, bridges, implants. Don't neglect your teeth, especially senior citizens. You know, I've seen they even stop brushing their teeth. So be with them, the younger generation. See to it that they're maintaining. See to it that their toothbrushes are changed. I'm even going ahead to tell you that. Sometimes I go and see dentures kept in very dirty boxes. And there's a fungus. Nobody's bothered to clean your dentures. And then there's fungus in the mouth. Where is it coming from? Dentures. Pani hasn't been removed for months and weeks. So guys, help them out in this, okay? And I'm finding that once the teeth are out, well, less food, less nutrition, fatigue, you know, deficiencies. The whole ripple is seen in the entire health from hair to toe. Then the guys don't eat well. They're supposed to pound everything in the mixer. Then the lack of food interest, then again reflects in the interest in life. There's so much to it. So this is more or less telling you about screening techniques, Sonam.
Thank you, doctor.
Wow, that was so comprehensive, doctor, about the imaging and the blood test. Thank you so much. My last question to you is, can you suggest a vaccination schedule for seniors, please?
Of course. Vaccinations, friends, most important. Why? Because obviously prevention better than cure. Now, I'm not going to touch on the COVID vaccine because too much has been said and done. Let's not waste time. Two most important vaccines for the senior citizens are, number one is the influenza vaccine to prevent the normal flu that can happen to you. In India, we have the quadrivalent vaccines. We advise that senior citizens after 55 and between 50 and 55, you can start taking this vaccine. It's to be given intramuscularly once a year, generally no side effects. Suppose you have some kind of risk factors or some chronic diseases, then you can maybe take it earlier. The second most important vaccine is the pneumococcal vaccine. That's the second one. We have the polysaccharide that covers 23 subtypes, and we have the conjugate one that covers 13 subtypes. We generally advise these two vaccines to be taken anything between 60 and 65. Some kind of risk factors then may be taken earlier. Now, the other vaccines, I would lay more importance to people who have high risks, or generally even for all senior citizens. Check out if you have taken your hepatitis B vaccine in the past. It is important. And if you have not, then go ahead, take your 3 vaccines with your doctor. Or you can even go and check your antibody levels. If your antibodies levels are not optimal, then go ahead and take these 2 vaccines. I'm talking about the hepatitis B, even the hepatitis A. If not done in the past, levels of antibodies are low, you can take your 2 vaccines. The other vaccines that I would like to talk about is the high-risk individuals. That means really falling sick all the time, highly immunocompromised, or dialysis patients, or in line for some transplant, or staying in one of those very high risk areas, morbid communities, old age homes, or slums, or one of those. Also check whether you've done your MMR, a Tdap injection, or sometimes even chicken poxes. We can just give one extra booster dose. What about the typhoid vaccine for seniors? All seniors are not needed to take the typhoid vaccine, only when there's an outbreak or you're tending to travel to a high-risk area. Typhoid vaccine is available everywhere. It's given intramuscularly, and you can repeat it every 3 years. What about the meningococcal vaccine? Not generally advocated for all senior citizens, but yes, when you have an outbreak, and when you're traveling to a high-risk area. In fact, the Saudi Arabia government suggests the quadrivalent meningococcal vaccine for all the Hajj pilgrims who are to be going for the Hajj 15 days before their Hajj travel. Now, one important thing I would like to tell you about the COVID vaccine before I end this question. Who should not take the COVID vaccine? ICMR guidelines, WHO says, everybody go ahead and take it. We're talking about heavy prevention on COVID. I would suggest that any patient who's had some kind of a reaction in the past to some kind of an immunization, like some nerve issue, we call it Guillain-Barré syndrome. So those patients don't take it. Secondly, I would suggest any patient who has some clotting disorders. One most important thing that has been a challenge for doctors and patients is clotting post-COVID, not only COVID disease, but even post-vaccination. So people who are having some blood clotting disorders, please take it with caution. And the third most important tip that I would like to give while taking the COVID vaccine is all patients who are on some kind of immunotherapy or some kind of chemotherapy, you plan it in such a way that you stop these drugs 15 days prior and 15 days after the COVID vaccine. For that ambit of time, don't take it. Why? Because the uptake is not going to be good. And obviously the efficacy of the vaccine is not going to be the best. This is more or less about the vaccination schedule.
Doctor, I just want to ask you one thing. जो chicken pox की vaccine आपने बोला, abroad में बोलते हैं shingles vaccine, क्या वो same होती है?
So now there are 2 types of, these are known as zoster vaccines broadly. So you have something known as a herpes zoster, and this is known as varicella. Yes, chickenpox vaccines are available here. In children, we give 2 vaccines, and in adults, the high-risk groups who do not, I see many Indians have had chickenpox in the past. So we do not, I always ask you, aapko ho gaya hai vaccine, disease, don't take it. Chickenpox immunity is lifelong, so unnecessary, don't go vaccinating. But high risk individuals, yes, check out your antibody levels. One of those rare where you can have bad medicine is not maths, you still never know. The varicella vaccine is available here. Zoster vaccine is not available in India. It is available abroad.
Ji.
Yeah.
Okay.
So that's the main thing. Yeah.
Thank you, Dr. Priya Gokhale, for this very, very vital information that you've shared with us. I'm sure your guidance on this many aspect of health and vaccination will be very valuable to seniors. Thank you so much for coming.
Thank you so much.
Doctor.
My last message for all senior citizens is aim for a holistically happy and healthy life with minimum medication. Okay. Thank you so much. And I wish that this is going to be helpful to all the senior citizens. And I pray that my talk was worth your attention. Thank you so much.
Thank you. Thank you, doctor. Before we forget, cheers to wellness.
Cheers to wellness.
Absolutely.